Madam President, it's been 2 weeks since the House and Senate Veterans Affairs Committees held our first conference meeting to fix the VA healthcare system. It is a disservice to our veterans that we haven't met again. My fellow conferees and I should be at the table actively negotiating a path forward. Chairman Sanders is right when he says that the situation at the VA is an emergency. I had the opportunity to meet with veterans last week in Hilo, Hawaii. My discussion with them underscored the urgency of addressing the long-standing issues at the VA. For those who haven't visited Hawaii, Hilo is on the Big Island of Hawaii. The Big Island is home to volcanoes and rainforests and just about every other type of climate. It is also twice as big as the rest of Hawaii Islands combined. In fact, it's roughly the size of Connecticut, but with only a fraction of the population. It can take hours to drive from Hilo to the second largest town, Kailua Kona. Of the roughly 143,000 people living on the Big Island, over 15,000 are veterans. I'm raising these facts because I want my colleagues to understand that veterans in rural communities like those who live on Hawaii Island need our help, and they need it now. The veterans I met in Hilo expressed to me that they can't get care anywhere other than with the VA on the Big Island, as private physicians are few and far between. In fact, while 90% of Hawaii Island residents have health insurance, there is a serious physician shortage. This results in long wait times for non-VA health care. Given these long wait times for private physicians, Big Island veterans rely on VA for their primary care. Those Hawaii Island veterans who have private insurance have paid for flights to the island of Oahu to get the care they need out of their own pockets. This means over $300 out of pocket just to get to the medical appointments. The $300 does not include any cost associated with the care itself. This is another reason expanding access to non-VA providers is needed to immediately address the VA health care emergency. With this expansion, we must ensure every veteran in our country, whether rural or urban, can more easily get the care they need if the VA is unable to accommodate them. Rural and urban veterans in Hawaii across our nation deserve better. A recent audit of the VA in Hawaii found that veterans were waiting over 140 days to receive care. A more recent update found that while progress is being made, that number is still over 100 days. Nationwide, nearly 60,000 veterans are waiting simply to get an appointment. Of course, this is unacceptable. This is why I stand eager and ready to work with my House and Senate colleagues to ensure that the veterans of this country get the care they need and the benefits they have earned. This conference committee must reconvene as soon as possible to move forward on the important task to finalize legislation that does 3 important things. 1, directly address the emergency circumstances that have been uncovered at the Veterans Administration. 2, ensure that all of our veterans receive access to the care that they deserve. 3, begin the long-term work of restoring veterans' trust not only in the VA, but in Congress's ability to effectively oversee the VA and provide the resources necessary to care for our veterans. Nearly the entire Senate agrees that the current VA situation is an emergency and that Congress must act. I'm hopeful that we can all agree on that point, but my fellow conferees need to be at the table now, face to face, to work out a solution to make the VA work for our veterans. I hope that we will include provisions in the Senate-passed legislation that will provide for 26 major medical facility leases and provide for the resources and authority to expedite hiring of VA doctors and nurses. In addition, while I agree that accountability of executives is needed, we should avoid politicizing the non-appointed civil service process and allow some due process for VA employees. Furthermore, our veterans rely on the services of qualified, committed professionals at the VA. In fact, the veterans I met with last week indicated that they really like VA care. However, they were concerned that VA doctors were already overstretched in terms of patients. I don't believe that simply telling VA doctors to see more patients is the only or best answer. Nor is it enough to allow vets to seek care from private providers. We should be doing more to attract more health professionals to VA, especially primary care providers. We have to recognize the long-term benefits of attracting a high-quality workforce to VA and that we can improve accountability in a carefully balanced way. Investing in the VA is an essential step toward building back the trust of our veterans. I understand my colleagues' concerns with the cost of the proposals before us, but inaction won't overcome those concerns. Those of us serving as conferees need to sit down and discuss how to get our veterans what they need quickly. The time for action is now. Veterans in Hawaii and across the country are counting on us and deserve no less. I yield the remainder of my time.